Hi everybody, I'm Phil Fatica and welcome back to the Millcreek Government Channel. We are Channel 9 or you might be digital at 97.2. You can find us either place, same shows airing. I'd like to introduce you to somebody you've not met before, somebody even new to the area, somebody who has a big job watching out for your health, well-being, and safety. Please say hello to Melissa Lyon. Melissa is the director of the Erie County Department of Health. Welcome to this table. Welcome to our area.
Thanks, Phil.
Yeah,
I
just
really appreciate being here.
So here you are in charge of a big area, the Department of Health, which does many, many, many things, which we'll discuss today. And how'd you get here? Do you have a degree in, or how do you get to be the director of? What's the process you had to use to get here?
Great.
You got about an hour and a half.
Well, I can't talk about myself for an hour and a half.
Okay,
However,
make it about 40 seconds.
I have a degree in Master's in Public Health. I earned that about 3.5 years ago. I started in public health in Chautauqua County about 13 years ago. And within that, I started out as a sanitarian. I did beach sampling, food service, inspections of all kinds. From there, I got very interested in health education and moved into that department, which required things along nutrition, physical activity, tobacco control programs, and eventually rolled into administration. Started doing more of the grant writing, budgeting, reporting. We do what's called a municipal public health services plan in New York. So from there, I realized public health is truly my passion, and I went back for my master's degree.
And here you are.
And here I am.
Okay. A lot of programs, as I said, that are under the umbrella of the Erie County Department of Health. And currently, there's one that you should be aware of because this is all seasons. It's called Let's Move. I'm going to put it right there. Let's go. Let's Move Outside. And elaborate, please. Let's Move Outside. You can pick this up at the Health Department, I believe, this brochure. And by the way, where's the Health Department located?
We're located at 606 West 2nd Street.
2nd and Cherry.
Correct.
2nd and Cherry.
2nd and Cherry.
As they say, you can't miss it. Big brick building, yeah, can't miss it. And is there a phone number that people could say, listen, I'd like to move outside, give me some more information on what is this pamphlet again? Because it kind of looks kind of cool.
Sure.
What's the phone number there?
Sure. It's 814-451-6700.
Okay.
And that'd be the Health Education Department.
Yeah. Good. Let's talk about Let's Move Outside, because I'm not sure that most people would say the health department is doing this. Really? So, all yours.
Yeah. So one of our activities, really, Phil, is getting people to move, physical activity. We know that we're looking at an obesity crisis in the United States. Erie is not just the only one suffering from this particular crisis. So just getting more active. And so we made activity fun. This is an activity that any family can do, any individual can do. You pick up one of these brochures and you find the trails. They're throughout the county.
Cool.
They have a piece of artwork. There's usually a little history design with it, and you accomplish these things as you go along. There's a little website, and you log your activities, when you visited, and what you discovered.
Oh, that's really great. This is quite extensive, too. I'm holding it up, and you can see right there, it's a rectangular booklet, and it's filled with all kinds of Union City Area School District Trail, the Greenway Trail, Harbor Creek Community Park, Pleasant Ridge Trail, Corey. So this goes on and on and on. So if you are one of these people that like to get out and do this in that Let's Move Outside, that's a really good thing. That's just one component of what the health department does. It does so much. By the way, I don't want to get too far into this. I have a really important health question about me, and I don't know who to call to ask. Can I call the health department?
You absolutely could call the health department.
Excellent.
We have what's called an intake nurse, and that individual actually is an RN. It is available from 8 o'clock in the morning till 4:30 in the afternoon, and you call that same phone number.
And the number?
451-6700.
6700. Okay.
And they would transfer you to the intake nurse. If we don't have an answer for your question, we don't have the resource that you're looking for, we would connect you with that in the community.
So, another service from the Erie County Department of Health for you. Here's another one. This is you might have heard about this, especially last year, and it crops up again. This is the algae, which seems to be spreading among the Great Lakes, and I hold it up there. And the real good caption here is, if in doubt, stay out. How does the health department play into that? Because if you drive along the bayfront, for example, you may see this green, and you're going, oh, wow, that doesn't look too good there. So how does this play out with you people?
Sure. So this year, the great news is we have not had any algal blooms identified this year. However, in the past couple of years, we've had hazardous algal blooms. They're hazardous because individuals become sick if they've been exposed to the toxins that's created by the algae. Ohio has really been the lead on this. They've had a lot more hazardous algal blooms, more than we have. They're a little bit shallower. They have a higher population. It's created by nutrient levels in the lakes.
Talking about pretty much though the bay or lake waters here,
Correct.
not so much tributary streams.
Correct. So more along the lake where water gets less movement. So summers where we have less rain and there's less streams flowing, you'll have more likely to have hazardous algal blooms. What we're doing is if we are informed of a hazardous algal bloom, we go out, we take a look. If we confirm that it is a hazardous algal bloom, we will put some signage up that indicates this is a hazardous algal bloom. You would want to stay out. It could be potentially dangerous for you, your children, and your pets.
Okay, that's another function of the health department. Their tentacles are many. Something you've heard about, I know, is rabies baiting. It's just cool the way they do this. What are they doing with rabies baiting?
Okay. The concept of rabies baiting is that we want to try to get vaccine out to animals that could be potential what we call rabies vectors, or individuals that are animals that have exposure to rabies vaccine, rabies virus. So they drop packets from the air. It's the USDA that actually does this. And those packets are silver. They kind of have a fish emulsion.
Yes.
And then they're impregnated with a vaccine against rabies.
Mostly raccoons they're looking at here, or?
Raccoons, small mammals, for example, coyotes, fox.
What happens if somebody picks one of these up on their property going, eek, we're being invaded here. What's coming out of the sky?
Yeah, really great question, because we do not want anyone to touch those packets if they find them. If they do find one and they can relocate it to a forested area, we would advise that they do that, but with gloves or a paper towel. Do not actually have contact with that. We would prefer that if you did have contact with it, there's a number on the packet. It's our number again.
Okay.
It's that 814-451-6700. And then if you were to call, we could advise what to do next if you came in contact with one of those packets. But ideally, it's so that the wildlife can have access to those.
That's fascinating.
Would you like me to tell you where that's being distributed? Because it's along
it's a long, narrow corridor between the Ohio-Pennsylvania line.
You got it.
Yeah.
4 to 7 miles between Ohio and Pennsylvania.
Okay, so it runs from the lake
all the
south down to far.
Yeah. Until they run out of baiting, I guess.
Okay. But they drop it out of a plane, which is, I think, really interesting.
It's very fascinating.
And by the way, it works. Yeah, it's proven that it works. So,
yes, in fact, that we're seeing lower positive rabies animals in the community.
Yeah. Probably the arm of the health department that most people are familiar with is the one called environmentals. These are the people who go out to the restaurants that you read about in the paper or you might see on TV, and they're the ones that say, you didn't, and then you did. So tell me about that, okay? That happens. That's all year long, all the time, and admittedly, it's a snapshot. They come in unannounced, and they go back and they go, so I mean, let's be a little bit careful about hitting them too hard. So what happens?
Yeah, so every restaurant is required to actually have an inspection. And that inspection is...
Not only every restaurant, but anybody who serves food or handle?
Correct. Yeah. So any of our, we call them food service establishments. Okay. So they could be retail, they could be restaurant, they could be temporary at a festival.
Festivals.
Or an event.
All these things that Erie has going on.
That's right. We're on the shore, Discover Presque Isle, all of those things.
They have to get your approval before they're licensed to serve that food.
That is correct.
Good for you.
It's about keeping the public safe, and even if you're a resident or you're a visitor, it's our job to make sure that the food that you have access to is safe for consumption.
Yeah, okay. Now, let's say that Phil has a restaurant. You come in, hey, how you doing? It's nice to see you, Melissa. Phil, I'm here to inspect you today. Oh, I didn't like this. You got a person using this that doesn't know how to use it, and this is dirty, and you better clean it up. And then you come back a day or two later?
It depends on the nature of the violation, on whether we would come back within a day or two, or if it would be along the lines of a week, or if it had to be corrected right on site.
Can you fine me if I don't? Melissa, yeah, everything's fine. Stop bothering me.
Yeah, typically if you've not corrected a violation and it's a reoccurring violation, then yes, they can receive fines. In
Okay.
general, it's our responsibility to help educate
Okay.
the restaurant owners and the food handlers. So really, when we identify violations, we're there to educate, help them correct those, and then not have it happen again.
Okay. Another item I think that most of you've probably heard about is that's probably front and center is the restaurant and food servicing visits, and that would be the STDs. That would be the sexually transmitted diseases, and that's huge. That's big. I want to be remaining confidential with this. I don't want everybody to know my business about this. So what do? I think I've had and I've come in contact with. What do?
Sure.
I'm scared to death. I'm 17, I'm 15, I'm 13, you know.
Sure.
I'm 25, I'm 40.
So we do have access to what we call walk-in STD clinics. I would call the phone number, 451-6700, to make sure that you have the exact hours of the STD clinics that we have.
Very confidential.
Very confidential. You walk in, you go into a private area, the nurse interviews you from there, and then from there they make the determination whether you're required to have a test or not.
Okay.
We also would ask you about partner notification. If by chance it became positive, you'd want to be able to notify the partners as well so that we could get them tested and stop the spread of that.
Yeah.
It's common, it happens, it's human nature. So we're there to prevent the spread of disease and to help individuals feel confident in the service that we offer and to be able to follow up with their partners. All confidential.
Free?
Free service.
Free service, yeah, that's good. Is it on a rise, STD? Is pretty much standard, it's holding its own, going down?
It's a great question. Right now, nationally, the trend is some increase in STDs. That would include chlamydia, gonorrhea, and syphilis. They are on the rise. We are trying some different activities to engage community partners to help us get the notification out that services are available and how screenings can occur.
Okay. What about tuberculosis? You hear occasionally there's spots around the country where tuberculosis is all of a sudden reared its head, and most people are going, oh, I thought that was eradicated. It is not in the third world countries.
Correct. And Erie is very unique in the fact that you are a refugee resettlement community, which means that you are bringing individuals in from countries that actually have quite a bit of tuberculosis. And so we do screenings for tuberculosis. We do follow-up and treatment for active cases, and also following of latent TB as well. A lot of that is also identified by primary care providers. Screenings are happening throughout the entire community. We're not the only ones that offer those screenings.
So that's an ongoing, I'm not so sure people would be aware of that. Here's a big one that rolled out a couple of years ago, and that is smoking, where the state said and the county said, well, you know what, we don't want you to smoke in this restaurant. If you want to smoke, you can go outside or you can go over there and smoke. How are we doing with smoking? E-cigarettes are starting to become popular. If you go to the casino, you notice that people are smoking e-cigarettes now. And tell me, smoking, did you ever smoke?
I did not.
I did. So, and I think you find people mostly my age probably did smoke growing up. It was the cool thing to do. And today, I have two daughters. One never smoked, and one quit many, many years ago. I think that the knowledge of what is going on is so much better, and people go, I don't want to do that to myself. But anyway, smoking, how do you work on that?
So our tobacco control program is one of our largest grants that we receive. And that has a multiple level approach. There's an enforcement component, which is preventing retailers from selling tobacco to minors. There is also an education component to help individuals prevent themselves from starting to smoke. There's the quit line, which helps people stop smoking. And then there's actually what we would call the advertising and advocacy piece, trying to minimize advertising to children and young adults, and then to advocate to our decision and policymakers to make good decisions for our young adults. It's one of our largest programs. We in Erie County have a higher smoking rate than the nation in particular, and the entire state. So we will continue to receive those dollars to do the great work that we're doing. It's not unusual for this particular area. Lower socioeconomics, access to cheap cigarettes is another one of those things. The taxes in this particular county can be lower than your two neighboring states. So that also increases the use of tobacco.
Yeah. Okay. There is so much, again, that the health department does for you. Let's take a look at, say, public health preparedness. That's a broad topic, I know, but what falls under public health preparedness?
Sure. So public health preparedness is very interesting in the fact that we should be preparing every day for an emergency. So in the health department, everything that we do every day is building us to be prepared.
And define emergency.
Sure. An emergency would be something that you don't necessarily deal with day to day. So for example, it could be something like an influenza pandemic or epidemic. As we've seen in past years, we watch influenza trends. If your influenza trends go high, then we may have to do something with large vaccination campaigns, requires more staffing and getting the word out to community members and engaging partners that we've never engaged before. So preparedness is really every day drilling and preparing and making the work that you do differently or do better, but do it differently each and every day. So it's an exciting piece. It's always done behind the scenes. Like, you may not actually know that we're doing preparedness when we do a drill or we send out a notification, but that's us practicing every day.
Okay. We've covered a lot of ground here in a very short period of time. You bring a wealth of information with you. Is there anything that I didn't touch on that you'd like to make sure that the public is seeing? By the way, we go to a lot of people here.
Sure. I think the only other one I wanted to really mention was the West Nile virus program.
Yep.
We do spraying for larvicide into areas that have standing water, that have larva, identified mosquito larvae, and we do spraying there to prevent the spread of mosquitoes and West Nile virus.
We've had a very wet spring and so far summer, and wondering if that has contributed to the larva not hatching, or is it really said, oh boy, this is a fertile ground, let's get going?
Interesting, because there's been so much rain, actually, that's been keeping the pools flowing, and it's been cool, so we've seen less pools of mosquitoes, actually.
Have you had a reported case of somebody contracting the West Nile virus?
We have not had one yet this year.
Oh, this is wood, so we can knock on that. Yeah, this is definitely. I want to go back to more things that you do have. A lot of the money that funds this comes from grants, and I want to brag on you here, so we can have a two-shot here. We are one of very few counties in the state that has its own health department. It is not run by the state. The county runs it. And because of that, everything that we've talked about today and everything that Melissa has answered happens and happens now, as opposed to something being, well, we have this emergency, you call the state in Harrisburg, and yeah, we're a little busy, we'll get to that in October perhaps, that's when we can spare somebody. So what we have in Erie County is not like everybody else has, and I want to make sure that you're in good hands, because Melissa's in charge and has her finger on the buttons and knows which ones to push. So congratulations to you.
Well, thank you very much.
Where would you like it to go from here? What would you like the health department to do that it's not doing?
Sure. I think the health department is offering many services that are much needed for your community. What I'd like it to do is to grow a bit, to maybe incorporate into more areas, more agencies. But when I say grow, it's growing in a way that's natural for the need of your community. So identifying what the needs are. If the need's not being met by any other agency, then the health department would look at, is there grant dollars available that we could help do that and apply for? So it will be a natural growth and not a forced growth. Something
is happening behind the scenes here that the public would not be too much aware of, and they shouldn't be. It's called accreditation process. And the health department has gone through this for quite some time. You have to write multiple pages to get this. Middle schools, educational institutions are aware of this. You have to meet a standard that runs from the kind of toilet paper you have to the kind of books you're buying, and you have to meet a standard of excellence. And so where are you in the process of that accreditation?
Sure. So we just finished the site visit, which means there were 3 members that come out to the health department.
Not from Erie.
Not from Erie. They're
not from Pennsylvania.
Not from Pennsylvania. They were from 3 different states. And they take a look at the documentation that we submitted. They interview us. They tour the facility and determine if we've met the standards. And there were over 97 standards, and we were proficient in over 82 of those. And so right now, we're waiting for the board to review the report and determine if we will be receiving accreditation. And if we do, we would be the first in Pennsylvania to be accredited.
Brag on that. Say that again.
We would be the first health department in the state of Pennsylvania to be accredited.
That's amazing. And by the way, that number, that 82 number, is huge. That's a big, big number there.
It was a heavy lift.
Well, it was a very heavy lift. Congratulations. A lot of stuff going on, of course, in the spring, the summer, and the fall. Fishermen coming up here, people using the beaches, and all of a sudden you drive down the peninsula and you see that big sign, beep, beep, beep. These beaches are not too good for swimming. What's being done about that? The E. coli and the problem that brings with it. Everybody goes, well, geez, what's the matter with those animals? They keep going in the water, or you got it.
Yeah. Well, what we have to do, required by the EPA, because we are in international waters, Lake Erie is between Canada and the United States, and therefore it's an international water. So our dollars come from the EPA. The EPA actually sets the standards. The beach, they're called bathing beach water quality standards that we have to test to make sure that they are adequate for swimming. So those are tested regularly. On summers that are actually quite rainy, like the one we're experiencing this year, it has a lot of rivers and storm drains and runoff that gets into the lake. With that comes what we would call fecal matter, whether it's from pets, whether it's from sewage systems not operating properly, ducks, geese, wild animals, and that all contributes to the water quality issue. The great news is we're actually testing it, and when the beaches are of good quality, they're open for swimming. The really neat thing we're doing is we're moving to what's called predictive modeling. So there's a lot of partners. Presque Isle's part of this. Some of the universities are involved. The health department's involved. EPA is encouraging and providing money to do this predictive modeling. So it looks at weather patterns, water currents, and bacteria levels, and hopefully we'll get to a place where we can actually do predictions. This beach may be closed tomorrow. So it's actually better planning.
Speaking of water, you touched on it. There's a lot of septic systems and wells in Erie County, and you play into that, the health department. You have the power to what?
Well, we do play into that. It is a state mandated program for what we call potable water systems and then private sewage systems. A lot of it is required that you need a permit if you want an on-lot sewage system, and you would have to apply for that. A sanitarian, or they call them protection specialists here in Erie County, and they would review your plans. They would approve them, come to your lot, make sure that your lot meets the requirements that have been set forward, and they oversee the installation of the system. Depending on the system, some of them actually require regular maintenance. Not all homeowners like to have the maintenance portion, but it is the beauty of having your home in a location that you love and have the ability to have on-lot water and on-lot sewage.
Yeah, I know that it seems that some of the people have had wells and septic systems for many, many years. They don't work forever.
They do not work forever. This is right. And then when it's time to upgrade, it's upgrading to an area, upgrading to a system that functions better and hopefully functions longer.
Yeah. And I know it's not a cheap date to do that. Our daughter lived in New Jersey, and they had a well, a septic system and a well. And the septic system it can be very, very expensive. Okay, let's take a quick review here. Melissa, you're just a fountain of knowledge. Thank you so much. This is for you. Let's move outside, and you can get this Erie County Recreational Passport at the health department. Stop in and pick it up.
Sure, and there's a website.
And there's a website, and it tells you everything that's going on. If you like to hike and trail and bike and canoe and everything, it's all right here for you. It kind of grates on me when people say, there's nothing to do here. There's so much to do here, I don't know what to do first. So if you are an outdoor person, this is definitely for you. If in doubt, stay out. This is the algae that could be very harmful to you. And if you have questions, call the health department, and what's the number there, and say, hey, I'm not so sure, but what's the number there?
That phone number is 814-451-6700. That's 451-6700.
Yeah, they'll answer all your questions for you. Anything that we did not discuss, and believe me, we touched a lot of ground here.
I think we did a really great job today,
I think
Phil.
you did a really great job. And Melissa is going to be at the health department for quite a while. She's got the reins now, and she's going to be making sure that everybody goes and does the things that they're supposed to do. Anything that you can or you're at liberty to discuss that is going to roll out for the more public safety? Are you going to partner with, let's say the 911 center? Because certainly they deal in disasters or potential disasters. Are you looking to say, look, we really do work together here. You got the last minute or so here.
Sure. So there are a couple of things that I'm working towards. I'm getting to learn the names and the faces and the players in Erie County, not just the government, but also in the community, those private agencies. So you can really look forward to seeing a lot more collaboration with the health department, both private and government. With public safety, one of the things I want to be doing is going up there and actually drilling. I'd like to see my staff go up and actually use the facilities, learn how to get onto a system. So if there was an emergency, Phil, everyone can just go there and they know what to do. They know how to log on, they know how to use the systems, and it becomes very natural for them. So that's one of the things we have planned in the coming year.
Sounds exciting. Sounds dynamic. And thank you for being here. Appreciate
Phil.
it very much. And thank you for being here. We appreciate your viewership. And until next time, I'm Phil Fatika, saying again, thanks to Melissa Lyons. She's the new head of the Erie County Department of Health. Until next time, everybody, take care.
You're watching the Millcreek Government Channel, powered by WQLN Public Media.